This presentation will examine Latino utilization of mental health services. As professionals, we join together in our commitment to improving the lives of the Latino community. Whether you are clergy, an educator, or a physical or mental health care provider, the information in this presentation can benefit you. We will address the Latino community's need for and knowledge about mental health services. We will cover the disparities in their access to and utilization of these services. Additionally, we will consider cultural differences that contribute to the quality of treatment that is administered and discuss the ways we can improve and support the mental health of the Latino community wherever we serve. As the largest ethnic minority group in the United States, which the CDC reports is expected to total over 30% of the U.S. population in the coming years, it's disturbing to realize the disparities of health and health care increasing between Latinos and the general population. According to a project by Coral and Norris, the prevalence of mental illness is similar between Latinos and white non-Latinos, but the utilization of mental health services in the Latino population is much lower. They report that only 1 out of 11 Latinos that meet criteria for a disorder contact a mental health specialist, and only 1 out of 20 recent immigrants do so. Many factors contribute to the low level of the Latino community's utilization of mental health services. First of all, many Latinos may not have knowledge about what services are available or even why they would need them. The National Association of Mental Illness informs that as a culture, Latinos don't generally discuss this, either because of a lack of knowledge in general, but also due to their strong negative stigma that results from highly gendered roles, where men are supposed to be strong and control their inner feelings, and women and children are perceived as weaker. Although it's more understandable for women and children to have these problems, Coral and Norris report that these negative cultural attitudes toward mental illness result in shame, guilt, and an unwillingness to learn about a perceived personal weakness. Additionally, the Handbook of Multicultural Mental Health informs us that Latinos often attribute mental illness to the supernatural, environmental conditions, or having strong emotions, with common treatments being herbs, folk medicines, and community healers. It's not surprising then that a report in the Journal of Transcultural Nursing reports that most Latinos receive mental health care from their religious leaders, while family support and folk healers play a role as well. Along with this, Coral and Norris report that many Latinos believe antidepressants are addictive, and that utilizing counselors isn't a good idea because it brings up bad feelings. Also, perhaps due to lack of knowledge about mental illness or cultural differences, Latinos conceptualize their troubles as somatic complaints, which may lead them to a primary care facility for what Romero and co-authors report are actually psychological disturbances. One aspect of the Latino community experience that improves rates of utilizing mental health services is higher levels of acculturation. An article from the Journal of Social Psychiatry and Psychiatric Epidemiology advises that stronger levels of Latino ethnic identity are correlated with lower levels of utilization, while increased levels of acculturation and assimilation results in greater use. This is supported by their report that with more social interaction with the host culture, Latino women use mental health services more often. On the flip side, less connection outside of Spanish-speaking interactions and fewer English skills are implicated with less access of care. Both of these indicate that lack of knowledge is a barrier, but with increased exposure to the host culture and consequently increased acculturation, there is more awareness of and acceptance for mental health service options. And while the process of acculturation is beneficial in improving knowledge about mental health and resources, the Latino experience in general is full of stress and rife with barriers to good mental health. The article, Mental Health Needs and Service Utilization by Hispanic Immigrants, points out many adverse conditions that affect mental health due to the immigration process. Some of these include a decrease in social connections and family support from separation, fewer employment opportunities, difficulty in receiving citizenship, economic hardship that results in impoverished living conditions, and living in areas of crime. Difficulty with a new language, along with decreased mobility, all combine to strain mental resources. Not only are these factors hard on an individual, many of them are the same things that contribute to not using mental health care services. Romero and co-authors remind us that a factor that affects every area of an immigrant's life is related to the difficulty of receiving citizenship. The fear of deportation and the trauma that results in families when deportation occurs affects every area of an immigrant life. Along with the stress that causes, fearing a lack of privacy leads to distrust and avoidance of many helping services, including professional mental health care. Another barrier to utilizing mental health care services is a language barrier. The fact is, most providers do not speak Spanish, and this is prohibitive to high quality and much needed treatment services. Not only does this prevent the 40% of non-English proficient Latinos from accessing good care, but the Mental Health Service Utilization for Psychiatric Disorders Among Latinos article informs us that Latinos have a preference for ethnic homophily, using services from other Latinos. This is due to stigmatization from peers and decreases engagement in help-seeking behavior. Finally, in a study conducted by Bridges and co-authors, Latinos report that economic factors were barriers to seeking out professional mental health care. 60% of respondents replied that costs were too high. 35% said that lack of health insurance was the main reason they didn't seek help if they needed it. Lack of transportation options also makes seeking treatment more difficult. Along with the barriers we've discussed, cultural differences arise between the Latino community and the majority of providers who are not Latino. This can decrease competence of service and quality of treatment. The article, Assessing and Treating Latinos, Overview of Mental Health Research, is very informative on this issue. First of all, a common theory of researchers and clinicians has been the cultural deficit model, where the minority's culture has been viewed as cause of an individual's problems. More recently, professionals have become aware of strengths-based theories, which recognize how an individual's culture and environment needs to be utilized to encourage positive development and improve resiliency. Additionally, the article educates us on the different perspectives the Latino community has and the cultural specific disorders this can result in. Along with their belief in spirituality and believing we may not know what causes mental or emotional problems, the symptoms they experience are not understood in a way we might recognize. Instead, their complaints are explained by having a mal ojo or evil eye, nervios or ataque de nervios, which can be violent and emotional outbursts, and susto, which is known as fright or soul loss. When chronic, this is very similar symptomatically to depression. While Latinos may understand symptoms and have beliefs that are different from a scientific standpoint, there are many ways we can bolster mental health throughout our communities and when professional treatment is. The article by Romero and co-authors remind us that understanding these cultural differences can make a difference in quality of treatment because we can tailor a diagnosis and treatment plan to integrate spiritual beliefs and culturally specific approaches. There are empirically supported strength-based and culturally relevant models that integrate methods such as cuentos, which is the Latino tradition of storytelling. Also, including family in the treatment process can result in better outcomes and improve support for proper mental care. Finally, in culturally competent mental health services for Latino immigrants, we read suggestions for how to meet the particular needs of this population. Outreach of providers into the community and coordinating with clergy and other community leaders is a good way to improve education about the causes of mental illness, the symptoms to watch for, and what services are available, encouraging families to be supportive for seeking treatment. Additionally, providers should receive continued training on cultural-specific treatment methods and be able to move beyond ethnic stigma to comprehend the many strengths that come from the Latino culture, which will unequivocally result in improved care and better support mental health of Latinos everywhere. Thank you.